I just heard that there was an active shooter, and it started in the radiology department, is what they said.
Okay.
And to stay put in my vehicle.
You were in the parking lot getting ready to go to work?
Getting ready to walk in, and all of a sudden I just heard a bunch of sirens, police cars, and another employee told me to stay in my car.
How frantic are you right now that you could have been directly in the line of fire?
I was just walking in. We were just going to walk in, another coworker and I. So very frantic, especially when I saw police on the parking structure with guns. I was scared. So I left the parking lot with my coworkers and went to my mom's house.
You know, and now it's getting colder out here. You know, nobody really knows what's happening.
Right.
From your coworkers' perspective, you say they're scared. Have you been able to talk with them and what
Yes.
they're feeling?
They said they are safe. My doctors are all safe. They're locked in our suite. A couple of my employees are locked in the suite.
So are they getting any other information from the hospital at all?
Nothing.
Well,
That I'm aware of.
All right, and being locked in the suite is the right thing to do. Ryan is back out there live and has a doctor there, again, giving us more perspective of what's happening there on the ground right now.
And we were seeing someone put on a bulletproof vest. We've seen other law enforcement with long guns walking that area. Obviously, we are a ways away from the scene. We're at a safe distance where they are allowing media to set up, where we had Ryan Marshall interviewing Barbara there from the radiology department. But your heart goes out to anybody who is inside that hospital because this is such an unsettling experience. You have people who may have had a surgery planned today. They may already have been there. They may be undergoing treatment for something in the hospital right now. But again, we do not know if people have been hurt in this. We are still trying to learn that. Hopefully at 8:45, we'll get that update from the police.
All right, well, let's get back out there to Ryan, who is joined by a healthcare provider there at Troy Beaumont. Ryan?
Well, good morning, guys. And we just happened to catch a doctor here that was coming into work, and he had no idea what was happening here. Sir, what's your name?
Corewell Agarwal.
And you are a doctor of general medicine?
Yes,
How long have you been here?
more than 35 years.
And when you pulled up to this perimeter right here to go into work to be able to help patients, what did law enforcement tell you?
They tell me there is something going on. Nobody's allowed to come in at this time.
Did anybody tell you what was happening? Did you know that this was an active shooter situation when you pulled up?
No,
In 35 years of working here, have you ever had a situation like this?
not in my life.
And so now that you're dealing with this or having to deal with this, you may have colleagues in there that may be in the line of fire. What are your thoughts now, not only for you, but for them that may be going through this?
God bless them. I hope that everybody's safe.
Yeah, it's certainly a difficult situation. Law enforcement, what did they tell you when you pulled up as far as how long you would possibly have to wait?
They say anybody's guess at this time. It may be 5 minutes, maybe an hour, maybe longer. They really do not know at this time.
And I think I heard, guys, that they said we might be here all day. Certainly, there are people that need help in there, patients. What are some of the patients that you serve in there?
In general medicine, I came to see a patient who's going for surgery and they need some medical clearance. So another general medical patient.
Yeah, and so now you can't go in there to do what you need to do to be able to help people with surgeries and other things because we have this lockdown situation. How troubling is that?
Well, it is definitely troubling, but the safety is still the most important part.
Yeah, certainly. Thank you, doctor. I really appreciate your time, talking with us very much so. And obviously you see right here, a lot of these medical staff here, doctors, nurses, they don't know what's going on. And in this case, with Dr. Agarwal, he had no idea as he was pulling up on DeQuinder, getting ready to go in to help patients with surgeries and different things like that. Still a very, very fluid situation here, a tense situation. We've seen people put on vests, long guns, armored vehicles, mobile command units, at least 2 or 3 dozen law enforcement vehicles here with lights and sirens and just people looking on here in DeQuinder from as far as the eye can see. Certainly a very difficult situation, but we'll send it back to you guys.